Again, what's next? What is the next step to learn more? Some true outcome studies would be fabulous. Randomized controlled studies to look at what happens to patients. Do we decrease their risk when we measure it on a direct basis rather than all the studies that look at it retrospectively? And what about the long-term pulmonary injury outcome in healthcare workers? That's a real challenge to measure because of all the other things that cause pulmonary injury as well. So in order to come up with a construct study where all of those are taken out, where do they live? How much smog was around that time? Do they smoke? Are they around secondhand smoke? All of the other things would take an absolutely huge number. And I think personally it doesn't make any sense for those of us who will never see the end of that study in time to make a healthcare decision to wait on that data. Practice options, really you have 3.5 choices. Number one, you can continue your standard practice. If you're already wearing specialty masks, respirator masks in certain circumstances where surgical smoke is predominant, yes, please continue that. If you're not, think about it. Is that what you want to do? You can always wear the higher filtration respiration masks when you're in high-risk situations. But the biggest thing is education. You know, if nobody tells us what lives in surgical smoke, how fast it travels through the room, and the fact that it gets to every single corner of the room, who knows? I didn't know until I took time to start reading the literature, because it's not something that we normally talk about because our focus is always on the patient. And again, that's not bad, but we have to learn to take care of ourselves too. So out of all of those, my few simple thoughts as an old-time surgeon is number one, common sense still wins. Think about the situation you're in and what are the risks of that situation. Number two, use smoke evacuators in cases where you should be using smoke evacuators. The mask is not designed to be the complete solution, just like the smoke evacuator is not designed to be the complete solution. We have a lot of tools. We should use all the tools that we can. Use proper airflow, but again, remembering that number two and number three aren't always under each of your control. Your hospital has to agree to buy the right equipment, have it available, and everybody has to agree to use it. However, number four is your choice, the appropriate choice of respiratory protection. I know in the United States now N95 masks are required to be available in the hospital setting. You have to search them out. Now in our window, there's still the blue mask and the green mask and the orange mask, but there's also an N95 mask sitting there. And everybody in our hospital system has to be fit tested for the right size N95 mask once a year, or in theory, they don't get a paycheck anymore. So the N95s are available, and in places where they're difficult to find, I have a lot of colleagues, because they're not that expensive, that just buy their own, so that when they can't one, they have access in their own locker to a cheap mask so that they feel better at the end of the day and their chances of the long-term bad outcomes go down. Just remember, you need to control your own safety. There are some things you can control and some things you can't. So I encourage you to think about your practice. What positions are you in? Is a regular surgical mask all you need? And there are cases where that is all you need, and that's what you should wear. Are there cases where, because of surgical smoke, because of the other things we've talked about, you need better protection? Then search that protection out and put your own safety in your own control.